Hi, it's Henry Shelford. I'm chairperson of SarcoidosisUK, here with Dr. Robina and thank you very much for doing another video. It's well, very much appreciated, and I know we had over 10,000 people look at the last video, so we know how important it is just from that. So Robina is here. She's a member of she's here as a member of the clinical board of SarcoidosisUK. She's a consultant in respiratory medicine with a specialism in sarcoidosis at Imperial College's Hammersmith Hospital, and she's clinical director of the National Institute of Health Research with a budget of around 14 million. But she's here as a
in the Northwest London
in the Northwest
Clinical Research Network, not the whole NHR.
Got it. And she's a doctor twice over with a PhD in travelling with a lung condition. So we couldn't have anyone better, and thank you again. This is our second video. We did our first video on February the 14th. We knew Covid-19 was serious then and wanted to provide information, and since then obviously a lot has happened. There are now 98,780 cases. It's in 93 countries. There have been 3,390 deaths. We've had 116 confirmed cases in the UK, and we've had the first death in the UK. There are currently just shy of 40,000 active cases worldwide. 33,000 of those are mild, and just over 6,000 are serious or critical. And in terms of the balance of how that goes, 81% develop mild symptoms, 14% develop severe symptoms, and 5% become critically ill. And so Robina, actually, that's probably a good point to ask you, what is the difference between mild, serious, and critically ill?
Yeah, so obviously those with mild illness may be able to stay at home. It may just be like having an episode of flu, whereas those who have more serious illness will need to be admitted into hospital, and those with critical illness may require intensive care.
And what's for people at home, what's going to be that tipping point between hospital, feeling like you need to go to hospital versus not?
I mean, I think if patients are feeling breathless, they certainly need to be back again in touch with their healthcare professionals, NHS 111, taking advice from NHS 111 and Public Health England.
And critically ill means you're in intensive care.
You're likely to need intensive care, absolutely, and you may need support for your breathing.
Right.
Yes.
The mortality rates, we've had questions on that, and WHO updated their numbers from 2% to 3.4%. The mortality rate does vary, and I think it's very clear that it's not understood right now. In China, it's 3.8% nationwide. It was 5.8% in Wuhan, but 0.7% in other areas, and that change reflects, better understanding the disease. That in Wuhan it was initially, for the first place. It could also be lower. I think we were talking about that earlier, because mild cases, many might not be reported, but it also could be higher because a lot of cases have not yet concluded. We know there's a lot of cases ongoing. The mortality is also expected to be worse in less developed healthcare systems versus countries with a stronger healthcare system. And the death rate of those admitted to hospital, so those are the worst cases, is currently thought to be around 15%, and the average days from first symptoms to death at the moment is 14. We know that underlying conditions and age are important. Claire, you asked a question about what the likelihood of fatality is, which we've just talked to, and Anthony wrote a question out saying, having sarcoidosis and being age 71, I understand I'm more at risk. What's the likelihood for people like me? So we know that if you're the numbers we have currently, and again, I think very, very important to stress that these numbers are don't have full clarity at the moment, but if 80 plus years, it's between 14.8% and 21.9%, 70, 79, 8%, 60, 69, 3.6%, and then it's 1.3% for over 50, and below that 0.4% for 40 to 49, and 30 to 39, 0.2%, 20 to 29, 0.2%, 10 to 19, 0.2%, and there'd be no fatalities from 0 to 9 years. Which, talking to someone with a 1-year-old and a 2-year-old, I have to say that number is good to see.
Yes.
Mortality rate for men is 4.7%, females 2.8%. Do we know any idea why that might be?
No.
No, we just know that is.
Yeah.
I thought it would be useful to compare it to other diseases. So SARS had a mortality rate of 9.6%. Seasonal flu is less than 0.1%. And Robina, I think some people say it's just like the flu. What's your reaction to that?
I think it's very likely that most people will have an episode of nasty flu and have to stay at home and look after themselves in the way they would normally do if they had seasonal flu.
Yeah. So that's if you have Covid-19, it'll be like flu.
Yes. The difference is, of course, that we don't have immunity to it. We haven't seen it before, and we're not vaccinated. So I think that's the concern. It's the unknown.
And one of the things is a lot of people think a cold is flu, and so their idea of what flu is quite distorted, whereas flu...
Yes, I mean, I think you're going, if you do get flu, you generally have a fever, your muscles ache, you feel tired, you feel weak, and you generally end up having to stay in bed and drink lots of fluids, and maybe take paracetamol to get your temperature down. So you're going to feel, you may well feel rough for a few days.
Rough and bedbound. Okay. I've always heard the sort of colloquial definition is that the difference between a cold and a flu is if there's 20 quid on the ground, when you've got flu you just can't be bothered to pick it up.
I hadn't heard that. Okay.
Like I feel too ill for that, and that part of answering that question is because there's some people with an ambivalence to it and saying it's just like the flu, and we know that it's not, and we know also that the flu actually can be dangerous for many. We've had 70 questions from social media, either through Facebook or Twitter or emailed directly. We've collated them as best we can. We will be going to some more questions that are posted now. So if you've got any questions, do post them. Hopefully we'll answer. We may answer them all as we go through. Let's talk first of all about precautions. So Sarah, Anne, and John all asked, what should they do in addition to hand washing? I think the hand washing message has got through well, and it's probably good to cover what hand washing actually means. It's not just like my 2-year-old who just...
No, it isn't. So Public Health England and NHS have very clear instructions on hand washing. You need to use water first, then soap. You need to wash your hands very thoroughly for at least 20 seconds, and that means all areas, including your fingernails. And then you need to dry your hands and dispose safely of the tissue or use an air dryer. So hand washing is key at the usual times before you eat, after using the restroom, after coming off public transport, all the things you would normally do, but just pay particular attention to it. So that's very important. And as part of that, you shouldn't be touching your face with hands that you haven't just washed. So we talked about this last time. It's very important to try not to touch your face unless your hands are clean.
And particularly it's mouth, nose, eyes.
Yes. And then the second aspect is trying to avoid close contact with people who are ill. Now, this is obviously not necessarily possible if it's someone in your household, but if you can, when you're out and about, avoid close contact with anyone who's unwell, that's sensible. And then the final thing is, if you are ill yourself, or if you have a cold, head cold, and you sneeze or you cough, you should sneeze or cough into a tissue and then dispose of that tissue safely. Or if you haven't got a tissue available, you should sneeze or cough into your sleeve so that you're not coughing or sneezing over other people. Or
onto your hands, which you're then going to use and
so try and reduce droplet transmission.
You talked particularly about toilets, though. So
yes, I mean, it's likely that this virus, like others, will be shed in urine and faeces. So it's obviously really important to think about hygiene in the toilet.
And you touched on household contact. So for instance, if I have the symptoms and I've got a young family at home, what do you think I should do?
I think it's very difficult. I mean, as I said before, we can't give individual advice. Generally, if you're the carer,
I was trying to use that as an example for everyone who's going home to their family that they obviously love and adore.
Yes, if you're the carer and you live with them, you probably don't have much choice.
Yeah.
And it's likely that it's going to spread between household contacts.
And I think as we were talking before, the likelihood is we've got an incubation period, so everyone is going to need to go into isolation as a family unit.
Yes.
By the time you're coughing and you've been been at home with them, they already are in a high risk situation. So it's going back to them is not going to change things. That's happened. It's happened already.
No, that's right.
I think
that's
what we think.
Yes.
And just so to reiterate the precautions, I think it's really important. So it's hand washing,
thorough hand washing,
social distancing, being careful when you cough, either into a tissue or sneeze tissue or into your sleeve, and also particular care around public toilets.
Yes, and try not to touch your face.
Ibrahim, Rachel, and Phil asked about the virus staying on surfaces. So being transferred from touching a surface, a hard surface versus a fabric. You talked about.
Well, I mean, there is persistence of virus particles on surfaces. We don't have the details on different surfaces. It looks as though it's probably persists less time on hard surfaces than on soft surfaces such as fabrics. So if you can wash fabrics, that's great. But just be aware, yes, it could be transferred from handrails on the underground, for instance, or on passenger trains, and it's likely to remain there several hours or longer.
Right. And then that comes to the point of not touching your not touching your face, so you don't conduct from your hand to you.
Yes, so by all means touch a handrail, you may well need to, but wash your hands afterwards before you touch anything else.
Kemi and Andy asked, should they wear a mask?
Well, the advice in this country is not to wear a mask. There's no evidence that it's effective in people who are healthy. Very tight-fitting masks, are difficult to wear for any length of time, and if you're already feeling a bit breathless, they can be quite uncomfortable. The only possible benefit is they might stop you touching your face, but people tend to remove them anyway a lot of the time. So how really effective they are, there's no advice that we should wear masks, and there's no good evidence that they're effective.
Yes, and people with a lung condition, for many, it's not an option anyway.
It's not comfortable.
No. The next set of questions on the symptoms.
Yes.
Ken and we were asked by someone who wanted to not have their name. How can you tell if the virus, if many of the symptoms are similar to sarcoidosis?
Yes.
So if you're already coughing.
Yes, we touched on this last time, didn't we? So typically it seems to be a dry cough and a fever, and then short.
And so sarcoidosis would tend not to have a fever.
Generally, you don't have a fever. There are some people who flare with a fever, but in my experience, it's a minority. So I think the fever is a clue, and then if you do develop worsening breathlessness, that should also be a clue.
Right. If you catch the virus, how long are you infectious to others for?
Well, the quarantine period, of course, is 14 days, and I would imagine it certainly wouldn't be any longer than that.
No, I think that's the official advice, 14 days.
Yes.
So we also asked, how can friends, family carers spot the signs? So if they, and that's for them, so if they see your temperature rising.
Dry cough, fever, yes.
Yeah. Sarah asked, I think it's an important question, what do I do if I become symptomatic, if I recognise the symptoms in myself?
Then I think you call NHS 111 or you go onto their website and you get the local help yourself. Yeah. And
we actually, so we went earlier and went to go and see the Covid-19 pod here to see how that process works. There's a lot of very clear signage saying go this way, because we've had incidents where people haven't known where to go, and they then stop you outside the door with asking you to call a number so that they can then prepare to receive you. And then I think the process takes over. But so that's the process here, is that there's signage, there's a place to go, and a number to call. We've had a lot of sarcoidosis specific questions, and that's clearly a big part of why we're here and doing this. Jennifer asked, are people with sarcoidosis more at risk of catching COVID-19?
Yes. I don't think if you're generally healthy, you have an increased risk. If you are on immunosuppressive medication, then you may have an increased risk of catching infection. But we don't have any data specifically on sarcoidosis and coronavirus.
And Robina asked, do people with pulmonary sarcoidosis need to take particular precautions?
It's difficult to know, it's a very good question, but it's difficult to know what extra precautions they could take. The thing I would say is it's really important that your condition is managed as well as it can be. So you take good care of yourself, you take your medications, take all the medical advice that you have and advice from your healthcare professionals, your nursing team and so on, and take as good care of yourself as you can generally. But I don't think there are any specific things apart from that we can recommend.
Richard asked about if immunosuppressants are more at risk. I think we've covered that. I think a good question from another good question from James was, if you have sarcoidosis, are you more likely to be severely affected?
I don't think we know, and I think it's going to depend. Sarcoidosis is such a broad condition, and people are affected in many different ways, and some people have quite mild disease and some people have more complex or more severe disease, and I think that's got to be factored in. So if you have severe lung disease, you may be at risk of a more severe illness, but we don't have data on that.
And Sheila asked the same question, but her sarcoidosis is in remission. I think it's the same answer. We don't have data. It could be more risk.
Possibly, although I would hope that if you're in remission, you're in better shape.
Although I think you may still have damage. So,
yes.
On a more positive, we had a question, is there anything people with sarcoidosis can do to strengthen their immune system?
No, not evidence-based.
No. Nothing that's going to move the double. Obviously eating sensibly and looking after yourself.
All those things, getting enough sleep, getting some exercise, fresh air, all those things. Fruit
and vegetables, the advice usual, everyone has had and follow to more or less degree.
That's right.
Richard asked, if he gets coronavirus, will his lung function could it be further reduced? Or the damage of the coughing?
It's very difficult to know, isn't it? It's possible that it might be temporary, and then there may be a good recovery, just as there would be from flu. I mean, I often find if patients do come to the department with a head cold, their lung function isn't quite so good, and then it picks up again a few weeks later. And I just don't think we know exactly what the outcome and the cause.
And have you seen people with flu and sarcoidosis? Do you notice that having a long-term
That can
impact?
happen. Most of my patients with flu don't come to clinic.
That's very good of them.
which is sensible. But certainly upper respiratory viral illnesses, head colds, sore throat, coughs and colds, they do reflect, that is reflected in a decline in lung function, and that picks up and recovers.
Okay, so it's not permanent generally in those circumstances?
In those circumstances it's not permanent, no.
Onto treatment. So we were asked if someone does catch the disease, is there anything they could do to make it easier for them to fight it? I think you've covered drinking water, taking paracetamol to reduce temperature.
Yes, all those things.
Anything else on that list?
Anything, gargling for sore throats, those things. It's sort of symptomatic measures that one would do normally for flu.
And we had some specific questions, which Jackie asked, there's been research to suggest people on TNF inhibitors might be better off because the antioxidants will become effective in stopping the immune response. Do you know anything about this?
Yes, well, it's a very good question, and there was some interest in TNF inhibitors during the SARS outbreak a number of years ago, and there was a suggestion that TNF inhibitors might be useful. But I'm not aware of any clinical trials at the moment, and I'm not aware of any specific data.
Okay. What is it for people? What is a TNF inhibitor?
Well, it's a form of medication that inhibits TNF release, and TNF is one of the inflammatory cytokines that is implicated in sarcoidosis, but can also be implicated in a number of other inflammatory conditions and responses.
Susanna asked if chloroquine or hydrochloroquine will have an effect on the virus, and Anthony asked about antibiotics.
Yes. So the chloroquine, hydroxychloroquine question is interesting. There is an ongoing clinical trial which started last month to look at this, but we don't have data from that yet. Antibiotics will be used by healthcare professionals for people who they think have evidence of pneumonia. So they may be used empirically, but they're not going to be effective per se against the virus. They will only be effective against bacterial pneumonia, but of course you could have both. We've got a question on risks on avoiding places. So Sharon asked if she should ask her husband not to go out for her protection. Robert asked, should he avoid the gym? Joe asked about public transport, and Joe about clinical waiting rooms. So, as we said last time, there's no specific national advice on that at the moment, although that may change. And I think it's a matter of individual choice, because I think it depends on individual circumstances. So you may choose to limit where you go, how much you travel, and who you associate with. But I think it has to be an individual choice based on your level of comfort with the risks that you're taking and your knowledge of your own condition. And that's going to vary for everybody. Yeah,
and that is with a new disease. I mean, one of the things that's so difficult is that it isn't clearly understood. There isn't clear advice. It'd be lovely to be at this point to go, here's exactly what you should do.
That's right.
But people don't know, and listening to the government advice on that is the thing to do.
Yes.
Because they have all the information. They have much more information.
Yes.
Putting it to, are you still taking public transport?
I am, yes.
Yeah.
I'm washing my hands very assiduously afterwards. Yes.
And what about, like, some people are sort of trying now to avoid rush hour so that there's less people around. Are you doing that, or?
Well, I often avoid rush hour anyway, because I often come in quite early and leave quite late. But if I had to travel in rush hour, I would travel in rush hour. I think it's likely a lot of us are going to get it.
Yeah.
We just have to ride that when it happens.
People have asked about travel, and I think this is a personal question for you, isn't it? Because I think you're looking to travel next week. So Alistair and Anne asked, should they fly? Julie and James asked about specific locations, Thailand and Morocco specifically. On the locations, I think Chris Whitty, the Chief Medical Officer, said, when talking to Parliament, said his advice for travel was that you might want to consider if you want to go to places with less developed healthcare.
Yes, I think that's sensible. But again, it's a case-by-case individual decision, isn't it, that people have to think about. I mean, there are obviously a list of countries for which travel, all but essential travel, has been advised against, if you like.
Look at the FCO notices.
Yes, have a look at that. Have a look at Public Health England. But aside from that, it's going to have to be an individual decision. And we talked about this last time, because you may or may not get insurance cover if you want to cancel a trip. Yeah,
I think either way you should get travel insurance.
Oh, you should certainly get travel insurance.
For two reasons. One, so that you've got healthcare
we always recommend that, yes.
And two, if the FCO do say they no longer recommend, then you'll get a refund, otherwise you wouldn't get you'll be able to get a claim from your insurance.
I was really talking about pre-booked trips, because not all insurance companies offer refunds, even if the FCO advises against all but essential travel. It's not universal. Okay. So you might want to check before you take out travel insurance, which we always do recommend. You might want to check the small print on the policy.
Yeah, that COVID-19 is covered, and that.
Well, it'll be infectious. It'll probably be under infectious outbreaks.
Right.
But not all insurers cover that.
Okay, good tip.
Yes.
And people asked about risks at work.
Yes.
And Paul and Rachel said, as frontline health, on travel in terms of flying, you've got a trip planned next week, and you're going.
I'm going.
Yeah.
Yes.
And I think that's very important to know that it is
yes.
You personally have thought about it
Absolutely.
and are happy to
I've
go.
thought about it, I've consulted colleagues, and I have colleagues who are travelling overseas. We're carrying on.
Yeah.
Yes.
And that's so Paul and Rachel said as frontline healthcare professionals, they're concerned about their protection against the public, and what should they do?
As frontline healthcare professionals,
Which I think you are as
yes,
well.
It's very difficult. You have to take all the same precautions, and there's no guidance at the moment for healthcare professionals with particular conditions. So again, I think that has to be an individual discussion with your line manager, your team, possibly your occupational health department, if you have concerns.
I'm grabbing the questions from over here. So we have had specific questions about people's personal work situation. I think that again,
Yes.
it's to follow the government advice.
Yes.
That's not something we can cover. And I think by covering healthcare and saying that it's carry on, that covers pretty much everything. That is the front line on this disease. So it covers other things. I think we've covered. It looks like we've covered any questions sent in. So I can't. I haven't seen anyone post it. So I think that means we've covered the things people have asked. Is there anything more you want to say on COVID-19 and sarcoidosis?
No, I don't think so. I mean, I think the only thing to say is that most people will recover from this illness. I think it's the uncertainty that is causing anxiety, which is completely understandable, but most people will recover. I
wanted to cover the question of, so if you do show symptoms and come in and you're saying to the practitioners, I've got sarcoidosis, is there anything particular that people should be saying to the person they're talking to, the healthcare professional?
Yes, I mean, I think it's just important to let the healthcare professional know which areas of your body, which organs are involved. So if you have sarcoidosis affecting your lungs, I mean, some people just have sarcoidosis affecting their skin or their joints. I'm not minimising that, but that's probably going to be less significant than
this scenario,
than sarcoidosis affecting your lungs or sarcoidosis affecting your heart. So I think it's just for people just to have the facts at their disposal. If possible, have some clinic letters with them so they can share information. That's always useful.
Yeah, and keep a note of what medication they're taking, so those professionals can then look at those. And
that is very useful. And I think if we're not necessarily saying you've got to travel around these days with a folder. You can have it. You can scan the documents onto your phone and put them somewhere safe and just show them. And that's terribly, terribly helpful.
Yeah.
Your current medication list and any clinic letters.
And that's important because there must be a decision on continuing that medication, how to manage that, and also what other treatment they're going to be providing, and could there be interactions with those drugs, and so those practitioners need to do that. And on the heart, I think the thing we want to particularly emphasise is that there is a known, it's up to 50% of people with sarcoidosis have some kind of cardiac involvement. We had the WHO talking about that one of the main factors around mortality was an underlying cardiac condition, and we as a charity have been concerned for a long time and are working on trying to raise the profile of the understanding of that cardiac involvement. So we're absolutely sure that there are people with sarcoidosis who don't know how much cardiac involvement they've got, and so it's very important, should they be presenting with COVID-19, to say, I have sarcoidosis, that means there's a potential cardiac involvement. Please, it is important to check my heart so that the strain of being under this disease doesn't ultimately cause some kind of a cardiac event. And that's something we really want to push and talk, and we're going to be doing some more work on that. I think that's everything. So, because I know you've got to go, you've carved out some of your time, which has been fantastic and very important.
You're very welcome.
Thank you very, very much for doing this. We know how important it is and hugely appreciate it. Thank you very everyone for coming in and watching. If you've got any more questions or issues, do contact us through all our contact details are on the webpage. Just Google SarcoidosisUK. That's it. Thank you very much for watching. Thank you very much.
You're very welcome.
Thank you.
Thank you.